Thank you for holding off from your lunch. I do appreciate it. I'll only be about 5 minutes, I promise you. I'm Sarah Gardner. I'm actually a tissue viability nurse in Oxford, but I'm a trustee for the Tissue Viability Society. And we have Jemell Geraghty sitting in the front, who's also a trustee. And we're just taking this opportunity, we've hijacked a slot, just to tell you about a campaign, an exciting campaign that's about to happen, called Legs Matter. I think most of you here will agree that we need to be doing more to address some of the issues around leg ulceration or lower limb conditions. And therefore, I think you'll probably admit that discussions are always being taking place. Someone mentioned earlier about we need to be raising the profile of some of these societies. So this had been discussed for over a number of years, but nothing had ever sort of happened to move anything forward. So in November last year, a group of us got together from various organisations to discuss the problem and to talk about moving a campaign forward. So we agreed that to give ourselves a stronger voice, it would be better if we collaborated with each other. We're all sort of sitting in our silos, I think, all doing some amazing work, but I think we're stronger as a voice if we work together. So the Tissue Viability Society, we decided to collaborate with these non-for-profit or charitable organisations you'll see on the screen. Accelerate, there is British Lymphology Society, the College of Podiatry, Diabetic Foot, the Leg Club, and Leg Ulcer Forum, and the Society of Vascular Nurses. And we just felt that we needed to somehow put together some sort of campaign that was going to improve and raise awareness of lower limb conditions. So we decided that the campaign needed to sort of focus on shaping and influencing practice and to be a platform for communicating standards and to improve access to good quality care and to ensure that there was patient centricity, which I think is a wonderful word in leg ulcer care. So in the early days, we decided, all of us, that we had a lot of expertise in our field, but we didn't really have much skill in terms of marketing or experience in marketing. So we were fortunate that in March of this year, we had an event which was facilitated by a marketing company, which allowed us to scope where we were going or what we wanted to do in terms of this campaign. And from that, the campaign was triggered. We needed to come up with a name, and we all agreed on Legs Matter, which we think is really good, a bit biased. And we had a strapline called Reshaping Care Together. So the campaign objective is to raise awareness and understanding of conditions of the lower leg and foot and to ensure the timely and effective care of them. And we decided that there needed to be two phases here. So the first phase would be very much around improving patient and public awareness of lower leg conditions and to improve the standard of care delivered by healthcare professionals. And the second part of the campaign, or the second phase, was very much around raising awareness of the impact of poor care to commissioners and policy makers. So there's more of a political campaign. We also discussed the need maybe to influence our educational curriculum in pre-registration education. At the moment, that's certainly on our agenda, because that underpins everything, doesn't it, if we're going to improve standards in the future. So our primary objectives are really what I've just said, I think. So that's making the public more aware of conditions of the lower leg and foot and the importance of seeking out advice sooner rather than later. So it's not just a matter of someone's got a lower limb condition and how to manage that. We wanted to make people aware of the risks of developing lower limb conditions. You know, I've got a daughter, she's 24, she's on her feet all the time. I talk to her about wearing hosiery. She thinks I'm quite mad. But, you know, she's in a job where she's going to be at risk, and we want to educate the public that way. But also to raise awareness for those experiencing lower limb problems, and maybe they're not getting the care that they should be, so they're not meeting the standard, to be able to maybe challenge that, to raise that they're not getting the care that maybe they need. We also want to empower specialists, so probably those of you that are here today, to allow you to carry on championing the standards that we are delivering, and also to educate generalist clinicians as well on the potential risks of not maybe managing leg ulcers effectively. Our secondary objectives are around making policy makers and commissioners aware of what our campaign is all about, and also the silent harm that is going on out there, whether it be financially or the harm to our patients when leg ulcers aren't managed maybe effectively. So where are we now? As you can see, we've got some lovely, bright, visual, creative images going on there. And that's actually been quite an interesting learning curve for all of us. As I said, we haven't got any experience really in marketing, so working with a marketing company, coming up with some of the creative visuals has been very interesting, yes. We have worked with a marketing company now, and we've undertaken a strategic workshop as to where we're going with our campaign. The logo and the campaign look and feel have been developed, and we've actually tested some of these posters that you're seeing on some of the slides with patients and the general public. And that's been quite fascinating because I don't know what you see what you're thinking when you're seeing some of these posters here, but some patients get it straight away and they know what the message is we're trying to deliver, but others say that it's not graphic enough. If you think about some of the educational material about, say, smoking, and you're seeing quite visual, graphic images, are we wanting to project some of that? Will that, allow patients to really understand about the seriousness of their condition? We are hoping the campaign will target different audiences. This is young to old, abled and disabled, multiple, all genders. We want it to target everybody. So we are developing resources to be directed at the care of the lower limb, and we are looking at, we feel very strongly that it needs to be a national guideline. At the moment, there's not a nice guideline on lower limb leg ulcers. We do need a standard, but we're quite a long way away from actually achieving that at the moment. We want improved access to high-quality care and good guidance for our commissioners, and easy, accessible, high-quality education for clinicians, patients and carers. One of the main things we are going to be developing is a website, because this is where all of our resources, there's masses of resources out there, aren't there? But it's actually having a central place for these resources to be available. That is being developed at the moment, and we're hoping to launch that in November at Wounds UK, and that will be accessible for people, whether it be clinicians or the general public. So that's it, really. We just wanted to raise awareness. We expect, to have more information on this through conferences, through e-drops, through journals. You will hear more. But as I said, the website is online to be launched in November, and we're hoping that all of you will join us to reshape care together. Thank you.